Right. Good morning, everyone. Welcome on this Saturday, sunny Saturday morning. Spring is trying to make its way through, which I'm very excited about. And thank you for joining us on a Saturday morning. Not a usual time we have programming, but I'm glad you could be here, whether you're live on Zoom, on Facebook, or maybe watching us recorded. So I'm Erica Narducci. I'm the program director for Cancer Support Community Delaware. We are a nonprofit that is available at no cost for cancer patients and their caregivers across the state of Delaware and a little bit beyond. Our mission is to empower cancer patients and their caregivers with knowledge, strengthen them with action, and provide community support as well. So today we're going to empower you with a little bit of knowledge. And it is my pleasure to introduce Jess. She is my intern this semester from Widener University. She's going to give you a little more introduction of herself and then jump right in. So, Jess?
Good morning, everyone. My name's Jess Duncan. I am with the cancer support community till the end of this semester. Been here since the fall semester. I am in a master's program for social work at Widener, and what got me into that program was that I've been in EMS since I was 18. So for over 18 years, I've been an EMT and then a paramedic. And just seeing how the trauma of the job and seeing like human suffering and injuries and illness, how it takes a toll on EMS providers, and just how more resources need to be available for paramedics and EMTs. So I wanted to be part of the change. And so I went back to school for it. And during that time, my mom, who had metastatic breast cancer, she had it returned. So I took a leave of absence and took care of her at the end of her life. She ultimately passed away in December of 2022. And it was one of the greatest privileges of my life to be able to take care of her and use all of the training I had as a paramedic and EMT, to be an advocate for her and to take care of her in my home. So when I returned to school and they said, "Oh, you have to do your first generalist internship," I found the cancer support community in Delaware and was like, "Oh my gosh, this would have been amazing for my mother and I to have as a resource." And I really wanted to get involved. And since I've been here, it's just felt like home, as I'm sure some of you that have experienced the activities and programs here can attest to as well. So Erica asked me to do this presentation on First Aid 101 due to my experience in EMS. And it's my pleasure to introduce the presentation to you. Basically, she gave me kind of free rein. And what I thought would be the most benefit to this audience was something that covered common emergencies that you might encounter at the home, workplace, even out in public, and just some insight into what's going on in the emergency. So that way it's not such this uncertainty and such a scary scenario because you understand the why behind the emergency and also what you can do in those moments that can really make a difference for that person or for yourself before EMS even gets there. So without further ado, here's what we're going to be discussing today. It looks like a lot, but we'll power through it probably a little over an hour. If you have any questions, like Erica said, I'm sure there's going to be time at the end to answer any questions you might have. So we're going to start with chest pain, which is typically a gray area in medicine. And the reason being is because you have so many different anatomy, anatomical systems that are in that area in the chest. It could be a muscular type thing, it could be a respiratory thing, it could be an infection, and of course, it could be cardiac in nature. And that's, of course, the biggest threat because you have your heart, it has muscle that if it is cardiac in nature, that pain, it's potentially blocking blood flow to that muscle. And once that muscle dies, it can't be recovered. So whenever we hear chest pain, you automatically get a paramedic coming to you because of the risk of it being cardiac in nature and the severity that it could have if it's not treated, and an intervention isn't performed in a timely manner. Um, it's important to know that all of the symptoms that chest pain that accompany chest pain can kind of point us in a pathway, a direction we want to go. But ultimately, the rule out for cardiac chest pain or of the heart would be blood work, which would show that there either the presence of distress signals from the heart in the form of enzymes in the blood or their absence. And EKG is something that paramedics do perform in the field. It can show a large majority of heart attacks, but not all of them present on the EKG. So the blood work is like the gold standard, and why even if we have a clear EKG in your home when we take it, we still encourage you to go and have the blood work performed. Uh, there's also differences in men and women. Women tend to have atypical presentation. If you've ever seen like dramatized on TV or in movies, it tends to be this classic, elephant sitting on my chest and everybody, holding the left side of your chest here. Women tend to have pain in the abdomen, in the shoulders, in the jaw, neck, down the arm. And also diabetics may or may not even present with pain. They might have other symptoms that, excuse me, are more prominent. And that's because as you deal with diabetes, you have nerve endings that they they develop neuropathy, so they're less sensitive to pain. And so that's another consideration. If your loved one or yourself are diabetic, you may have more of the sweaty skin, the nausea, feeling faint, dizzy, those type of things. So the biggest things are you're going to want to note the type of pain you're having and does it move anywhere and what other symptoms are you having? Some other symptoms here, as you can see, include the dizziness, the pain in various locations that may not be right directly over the heart. It could feel like discomfort and pressure more than a pain. Cold, sweaty skin, nausea is a big one, vomiting sometimes. Shortness of breath is another uh, pretty good indication that there's something big going on. So the biggest things is allow medical providers to evaluate you and determine if it is cardiac in nature. If there is a indication for aspirin, because of the way that the pain is presenting, the gold standard right now is 4 baby aspirin or a 1 adult aspirin, which would be 324 or 325 milligrams of aspirin. And what aspirin does is it acts as a anticoagulant for blood cells, and so it prevents the blood cells from congregating together and sticking to one another, which can be a source of a clot or blockage in the small vessels of the heart. And if there is a blockage in those small vessels, anything downstream from that clot or blockage would not be getting the oxygen and glucose it needs to survive, and it would be at risk of dying. So next, we're going to talk about strokes or mini strokes, which are also due to similar scenarios where there is an area downstream of a blockage or of a bleed that is not getting the blood flow it needs to survive. And so there's a risk for that area of the brain to be unrecoverable and unable to heal, which would most definitely affect the quality of life of that person. So they've come up with a acronym to help you remember the signs and symptoms of stroke. The first is, well, it stands for B fast. The first is B, which is for balance. If you see somebody that is unsteady on their feet and it's sudden in nature, they're unable to walk, that is a red flag on the field, so to speak. You're looking for issues with eyesight for E. So if they have a sudden loss of any of like their peripheral vision, or one side or the other is experiencing the inability to see, those would be indications. For the F, it's face, or like a uneven smile, or one side has a droop and the other doesn't. For A, it's arm, or looking for weakness or paralysis of the arm, being unable to move it, or it not having the same strength as the other side. For speech, we're looking at slurred speech, or it sounds different. It's pretty pronounced typically, to those close to you or to your loved one. You'll be able to say definitely, yeah, that sounds different. It may not sound as different to EMS providers, so that's a really big thing to let us know if you hear a difference in speech. And T is for time, because the longer that that area of the brain downstream from a bleed or a clot goes without oxygen and glucose, the more likely that it's not going to be able to be saved. And that can really impact things like ability to speak, move, um, even memory or speech. Your entire quality of life is dependent on brain functioning. So we really encourage you, if you see these signs, to not just drive someone to the hospital, because there's a lot of things that can be activated by paramedics en route. We can call a stroke alert, which would mobilize a lot of resources and a lot of specialists to the bedside on arrival of the patient to the hospital. That can really make a difference in streamlining interventions, and it really saves time in the long run in the course of care. Even if you might have to wait 8 minutes for an ambulance to arrive at your home, they have the ability to navigate traffic with lights and sirens, so they could save some time in the commute. And they'll also save time on the back end in the hospital side, because they're already going to have mobilized everything for when they get there. Okay. The so along with noting any of these symptoms or signs, you also want to let EMS know when the last known well time is, or last known normal time is. And basically that means before they had these deficits that you're seeing, this balance issue, vision loss, facial droop, arm weakness or paralysis, the slurred speech. When was the last time somebody saw or spoke to them and they were at their baseline? Next, we're going to talk about seizures. So seizures are due to a hyperactivity of the brain. So there's different causes for that. It could be a injury to the brain. It could be from drug or alcohol intoxication, a brain tumor. Fevers can do it. If you've ever been around a child that had a febrile seizure, it's from the rapid increase in body temperature, just causing a hyperactivity of the brain. Certain medicines, especially medicines that the brain can become dependent on, and then they're if they go into withdrawal from that, they can cause seizures. Infections can cause seizures. Um, if the person is pregnant and they develop seizures, it can be a sign of a life-threatening condition called eclampsia or preeclampsia. And sometimes epilepsy can be triggered by things like television shows and video games and such. So it used to be that the old school recommendation for the general public was to stick a spoon in someone's mouth or some type of object to prevent them from biting their tongue. They don't recommend that anymore. Now they ask for you to roll the person on their side, like you can see in this picture here, and protect them from hitting anything nearby with like the arm movements and such, leg movements. Um, Mostly they want them on their side, because that is going to allow anything that is any stomach contents that are vomited up during the seizure to be expelled from the body rather than enter into the lungs into the airway. So anytime you see a seizure with all of these different causes, you can see why it's really important to call 911, have us come out and evaluate. And I will say now, anytime we come out and evaluate, it doesn't mean necessarily mean that you have to be transported by EMS. If you are awake, you know who you are, where you are, what's going on, what what the year is. Those are simple questions. If you can answer those orientation questions, we cannot kidnap you and take you against your will. But we are able to come out and evaluate you and give you our interpretation of your signs and symptoms and just give you a better foundation to make an informed decision about your care from there. Whenever you have a seizure, with all these different things that could be behind it, um, you want to rule some of those out because in a lot of cases, it might just be a matter of time till you have another one if you don't have an intervention from a doctor. Next, we're going to talk about diabetic emergencies. So a fun little way to remember the difference between high and low sugar. Low is hypoglycemia and high is hyperglycemia. Is this saying here, cool and clammy, give hard candy. So that means that their blood sugar is low, and when your blood sugar is low, your body is going to respond to that by activating the stress response and releasing stress hormones like adrenaline that will, of course, raise the blood sugar a little bit, but they also cause sweaty skin. And so when you see that, that's a definite difference between the other presentation, which is for high blood sugar. And when that happens, the body responds by drawing fluid from the cells on the surface of the skin and back into the bloodstream because it's trying to dilute all that syrupy blood that's in the bloodstream. So that's a really good way to kind of indicate the extremes of blood sugar, if it's high or low. Other symptoms that you will see include for low blood sugar is they'll be a little off. That can range from being a little irritable to completely unconscious, or they may be acting completely different than normal. Some people get a little aggressive when their blood sugar drops. They may be having difficulty walking and with their balance, and they may seem sleepy to you. Someone with high blood sugar, on the other hand, is going to be really thirsty. They're going to be urinating a lot. They may have blurred vision, and they're just not themselves either, but it's more of like illness, like they're suddenly just not themselves because they just don't feel well. So this is another situation where EMS can really make a difference. If someone's blood sugar is too low and they're not able to swallow, we don't recommend giving them juice or anything sugary by mouth because there's a risk that they could aspirate it. And that just means that instead of the contents, the food going down into the stomach, it would go down into the lungs, which could cause a really nasty infection. But for EMS paramedics, we could start an IV and give them glucose intravenously, which will rapidly increase their sugar and bring them back to baseline where they can then eat some food. And in the case of hyperglycemia, you can we can start an IV, we can give fluids on the way to the hospital, start the diluting the bloodstream, and monitor the blood sugar. We don't do any insulin in the field, and that's just because it needs to be closely monitored and taken care of in the hospital setting in a way that is uh, carefully thought out, so that way there's not any other emergencies that result from it. For allergic reactions, some of the common signs and symptoms that you might have from an allergic reaction, not due to seasonal allergies, but more like an allergen that is causing a true allergic reaction. You might have hives develop, wheezing, dizziness, chest pain, the airways will start to swell. it presents like trouble breathing. They may be very itchy. They might have runny nose, runny eye, watery eyes, develop a headache, things like that. When you see these signs and symptoms, especially if it's like directly after they've been exposed to something, the faster the onset from being exposed to that allergen, typically the stronger the reaction is going to end up being. And it also is dependent on the dose of how much they were exposed to and the route that it was exposed to. So, um, injection, for instance, might be worse than um, just something getting on the skin. So, what you can do in those moments is when you identify an allergic reaction occurring, and this patient, let's say they have a history of a severe allergic reaction, Benadryl is going to be the go-to for them. If they have any swelling of the airway, like their voice sounds hoarse or they feel like it's swelling in there, you're not going to want to give them anything by mouth. The paramedics have Benadryl that they can administer IV through through the vein, and that will prevent any possibility of the pill getting stuck or going into the lung field instead of the stomach because of the airway swelling. When you call 911, the dispatchers will talk to you about all of this, and they'll also ask you questions like, is this person, does this person have an EpiPen, or do they have a history of a severe allergic reaction? Things like that, which would indicate a higher triage level, so to speak, higher indication for a severe allergic reaction.
Jess, I'm going to jump in and ask a question that was asked going back to the strokes before we get
Yeah.
too far in. Do all the symptoms need to present, or can only two occur during a stroke? And is there a difference in stroke between a man and a woman?
So, no, not all of the signs and symptoms need to be present to for it to be a stroke. Any one of these in isolation, in fact, could technically qualify as a stroke. It really depends on the other information. Like, if someone has had a fall recently, it may be that they have a head injury that could be contributing to like a bleed in the brain that would be a hemorrhagic stroke. Um, if they're if they have facial droop but and slurred speech but no arm weakness, it's not necessarily indicating that they're not having a stroke. It would still be evaluated further at the hospital. It just may be a smaller blockage than if all of these were presenting, for instance. There is no difference between men and women in the presentation of a stroke. I think that it's also worth mentioning, didn't mention this before, about mini strokes or transient ischemic attacks. They're also called TIAs. They tend to be what is known as a warning stroke because they can have these deficits that resolve on their own without any intervention from EMS or the hospital staff. Um, but then in the next few days or weeks, you could have a larger stroke without any interventions. It can be a sign that there's a blockage in the small vessels of the heart that needs, or excuse me, of the brain that need to be addressed, or a change in medication, something like a blood thinner might be indicated. So it's still, even if these symptoms were to resolve, it's good to be going to the hospital, and it's good to go by EMS too, because they can monitor you for these changes. So, all right, moving right along to poisoning and toxic materials. So as you can see from this diagram here, there's a lot of different toxic materials just in the home alone. Um, I'll draw your attention to cleaning products. They tend to have a lot of information on the back of them that is in small print and easily ignored. but has some really good information as far as when these materials might be toxic. Some things it's really toxic to inhale them or to get them on your skin or in your eyes. Um, so each specific material might have a different treatment. It's pretty common practice for us to like rinse off, things that are on the skin that are burning, or if you get something in your eye, to rinse your eye out. Um, but I would suggest this hotline number here. It's called the Poison Helpline. We carry it in our phones in EMS and can consult with them about anything that we're unfamiliar with or we don't see often. Even the emergency room doctors use this number, and they offer really valuable insight into that specific toxic material and how to um, treat exposure to it. There's a number of different ways you can be exposed. Like I said, you can inhale it. You could swallow like some of it on your hand, eat something with it on it. It could get in your eyes, your nose, your mouth. That would be a mucous membrane exposure. Or it could be an injection. Let's say there was a rusty nail and you slipped and you cut your hand on it. That could be an example of a exposure in a way. So, pool chemicals tend to be very, very toxic, especially if they're inhaled. And bleach, ammonia, there's certain things that if they interact together, they can cause a even more toxic inhalation. So, all things that um, you want to just take into consideration, and also keep that phone number handy and in your phone even, um, just so that in that moment you didn't have to like Google the number. It's already there. You just type in poison and it comes right up for you. It's one, it saves you time, and two, just taking that um, thought process out of it. It just helps in an emergency when things are a little like scary. I'll have that number again at the end if you didn't catch it yet. So for bleeding, there's different types of bleeding. We have capillary, which is like if you were to cut your skin with like a paper cut and you get that small amount of bleeding. It may have a little bit of viscous fluid in it, and it doesn't take much to get it to stop. A little bit of pressure, running under some water. With venous bleeding, you could think of something like you were cutting an onion and the knife slipped, excuse me, and cut your finger, and you have some darker blood that's flowing, but it's not spurting. It's more of just a constant flow. You're going to hold a clean towel or gauze pad to it and hold that pressure until the bleeding stops. Um, for arterial, you're looking at a much larger vessel that is involved in the bleeding, and you're going to see uh, spurting from the wound because of the back pressure from it being in the artery that the blood is coming from. So the larger the bleed, the longer you're going to have to hold pressure. You want to have some type of barrier to not introduce any bacteria into the wound, or um, foreign bodies like dirt, for instance. So gloves are the best bet, but some type of barrier so that you keep the wound as clean as possible, and also you protect yourself. Um, you can use a gauze or a clean towel to put as a barrier. And if the bleeding does not stop with direct pressure, you can consider using a tourniquet to stop it. This is indicated for an arterial bleed, where it's spurting out. You're probably going to have a lot of difficulty stopping that blood flow with just direct pressure. Some ideas for things that you might have around you that you could use in an emergency as a tourniquet would be a belt, a tie, or some long, flimsy fabric, like a curtain, for instance. Some curtains are flimsy enough that you can kind of twirl them up. You want it to be a couple inches above the site of the wound, and you want to continue to constrict it until the blood is no longer, the flow is no longer continuing to spurt and it's no longer bleeding. This is, of course, a scenario where if you're unable to control the bleeding, you definitely want to call 911 sooner than later. We have tourniquets, and we also have a clotting agent that we can place on the wound itself that can also promote some coagulation and clotting. For burns, it really depends on the type of burn and the degree. When we talk about degree of burns, we tend to talk about first, second, and third. Some specialists have even more designations. They might have like a second degree type A, second degree type B, things like that. But all degree is really indicating is the depth of the burn. First degree is going to be more superficial on the surface of the skin, and then third degree would be all the way through all the layers of the skin into fat, connective tissue, muscle, or bone. Third degrees tend to be painless because of the nerve damage that occurs. There's the less sensitivity to pain there because of that. And the appearance will be more white, brown, or black in appearance, charred in appearance. There's different types of burns. Like I said, you have your chemical burns, electrical, heat, cold, radiation. Um, Thermal burns are going to be the most common thing that you encounter in just daily life. And so we'll go into that a little bit more on this slide here. So the first thing you're going to want to do is remove the source of heat that's causing the burn and cool down the site with some cool water. You can use antibiotic ointment. You can use cold compress. You can take some over-the-counter pain medicine and even use aloe vera. But other home remedies like egg whites or oil and butter, toothpaste, those are all no-goes. And the reason being is because they can irritate, the toothpaste can irritate a burn. Egg whites can introduce bacteria, and oils and butter can also prolong healing and also introduce bacteria. You don't want to pop any blisters that you might see, and you don't want to use ice or cold water directly on the site. In this illustration, you can see how the different stages of the burn, they go from right on the surface to having blisters in the second degree, excuse me, and then in the third degree, you see how it's going very deep into the skin, past the skin layers there. So when to call 911? If your face, your hands, your feet, or your genitals are burned, that's a indication to call us because that can have effects on quality of life. If it's stage 3, or like there's any indication of whiteness, brown, black to the burn, those are all indications that you should call us. And if there's a larger than 10% area of the body that is burned, that's another indication. So like you can use the inside of your hand here to as like an indication of 1%. So if there's 10 hand of whoever is burned, their hand, 10 handprints in that area, then that's going to be a large enough burn that I would definitely call 911. And chemical burns are another reason to call us. Common sign and symptom is fainting and dizziness. Sometimes people get dizzy and feel like they're going to faint, but they don't actually faint. The big thing with this sign is it's another gray area in medicine where it can be really indicative of an emergency situation. So there's some things I would really encourage you to pay attention to. The first thing is you're going to want to lay down if you're feeling dizzy or like you may pass out because you don't want to have that continue to spiral and then you have an injury on top of whatever else is going on. And you want to see if that laying down, if that helps the lightheadedness subside, because that can be more of an indication that you might be dehydrated or it might be medication related. And paying attention to any symptoms before, during, or after the dizziness or near syncopal, or excuse me, near fainting, or if the person does actually faint. All of these things could be a sign of a serious medical condition, so it's really important that you don't uh like basically blow it off, you know. There are some things sometimes where like just getting up so too quick with certain medications, it could be simple as that. Um, but I don't want anyone to assume that, because it could be a sign of heart problem. It could be related to a mini stroke or stroke. So these are important things to report to your medical doctor. And if they continue to occur or get worse, to not ignore. Another common symptom that can be related to bigger medical issues is nausea. Uh, with that in mind, if it is related to something like something you commonly experience, there's some holistic remedies that tend to help. One of them is sniffing an alcohol prep pad, like you would use if you were checking a blood sugar or cleaning a cut. Um, and the reason is for this isn't really known, like why it works, but it works so well that they even ask EMTs that to have this on hand for patients that are nauseous in the back of an ambulance. They think it might have something to do with distracting the brain uh, with this noxious smell, or it could be related to the receptors in the reflex area that are related to vomiting in the back of the brain and the brainstem are activated by prep pad smell as well. And the other thing is peppermint hard candy can be of use for nausea, and they think that that is because it soothes the GI tract and helps with smooth muscle relaxation and keeps the GI system from like contracting so forcefully. There are prescription medications that are available too. So the biggest thing is that it could be related to a heart issue or something else going on. So just paying attention to it and monitoring it and reporting it to your medical provider if needed. Common minor injuries in the home are falls. So if you can't tell us why you fell, let's say you tripped over something and that is only ever happened one time, that's different than I'm not sure why I fell. I just woke up when I was on the floor. Those are going to be higher index of suspicion for us because they could be related to something else going on medically. It could be related to dehydration or something. So if you're unable to tell us what caused the fall, it always increases our spidey senses, so to speak. Sprains and strains of a joint. Did you feel or hear a pop when that happened? If you did, then that's a higher index of suspicion that some connective tissue might be involved. A ligament or a tendon might need to, be evaluated with imaging to make sure that it's still intact. But otherwise, the Rice method is typically what you would want to keep going with until you feel better. And the Rice method is rest, ice, compression, and elevation. You can use ace bandage for compression, just wrapping it around the joint. And for minor cuts, you want to keep it clean. If it's likely to be reopened by some activity like swimming or dishwashing, you want to protect it from infection with some type of barrier like a Band-Aid.
And we had a good question. Sorry, before you jump into the next one. What's the difference between sprain and strain,
Mm.
or would they be the same thing?
Nope. So they are medical terms referring to whether it's a ligament or a tendon that is injured. So a strain would be a tendon and a sprain could be a ligament. Medication considerations. So I have seen on a lot of different medicine bottles, like don't take with grapefruit or don't eat grapefruit within so much time of taking a medicine. And why is that? Well, grapefruit is a big um, barrier for metabolism of some meds. It prevents the body from digesting the medication properly. In some cases, it could result in more medicine than is supposed to be being in your bloodstream, or it could be less than it's supposed to be, or none at all. So if you see that message, it's really important not to ignore that because it could really interfere with metabolizing your medication. If you see messages on your bottles in reference to a blood pressure or heart rate that needs to like be met, that they call it parameters, those are really important to pay attention to too. If you have low blood pressure and you take a medicine that's for high blood pressure, um, it could lower your blood pressure to really low levels and cause a medical emergency. Same thing with heart rate. If you're taking a medication that's meant to help somebody with tachycardia, like a AFib, atrial fibrillation, or something like that, and your heart rate's too low, when you take that medicine, it could also result in a medical emergency that results in an ambulance ride. So, um, being aware of those type of things. Blood sugar is another thing. If you take insulin, which is meant to decrease blood sugar, right? If you take that when your blood sugar is already low, the chances are higher that you're going to have a low blood sugar emergency requiring an ambulance ride. Uh, so for ibuprofen, there's some risk factors to be aware of. It is one of the barriers is a platelet issue. So for cancer treatment, especially, platelets tend to be lower with some types of chemo or um, even the other medications you're on. So when you take ibuprofen, it also prevents platelet production and can contribute to low platelets. It's processed in the kidney. So if you have kidney problems or if you're, let's say you're in the hospital, they're one of the reasons that they more promote taking Tylenol over ibuprofen is because if you need any imaging while you're in the hospital, which is more likely to happen when you're in a hospitalization, um, contrast dye also takes a hit on the kidneys. And so if they give you ibuprofen, that's even more of a hit that your kidneys are taking with other medicines like vancomycin. Some antibiotics are really hard on the kidneys as well. So the contribution of ibuprofen plus the contrast dye plus the antibiotic might be overwhelming for the kidneys. So these are all things to just have in your back pocket and back of your mind as you're choosing whether you want to take an I like a NSAID like ibuprofen or Aleve versus Tylenol. And then Tylenol is processed by the liver, which makes it a better choice for the hospitalization because it doesn't impact kidneys and but it can be in play if someone has liver cancer or a liver disease. So both of them have their positives and negatives, and both of them can also mask fevers. So if you the fever being one of the red flags in cancer treatment, you know, of a underlying infection going on, and it's a big deal. If you're taking Tylenol and ibuprofen, you may not see that as pronounced, or you may not see it at all. And then any medication, being aware of the overdose, underdose, and withdrawal potential of all medicine. So withdrawal would be more in play for anything that crosses the blood-brain barrier, things that you take for mental illness, or things that affect mood or um, So things like anxiety, substances like alcohol that affect your consciousness, all those things have the ability, if the brain becomes dependent on them, to cause withdrawal symptoms if they are not properly weaned off, so to speak. So even things like gabapentin crosses the blood-brain barrier and can have withdrawal effects. So if you are on those medications and you decide you no longer want to take them, you're going to feel really much worse if you don't follow a regimen that's established for weaning yourself off of it, for instance. There's also medicines that interact with one another. Pharmacists are really good at looking for these type of things, but pharmacists are people too. So it's always great to be an advocate for yourself and to have an understanding of what medicines you have at your disposal in your treatment plan that could interact with one another, how they interact, things like that. And another really important in consideration is how does this affect your ability to operate machinery and sharp tools, like knives, power tools, lawnmowers, and driving a vehicle? Narcotic pain medicines, for instance, I'll have a warning on them. Some anxiety medicines have that warning, and it's really important to pay attention to. So these are some of the medications and supplies that we've talked about in this presentation that are good to have on hand. Traditional first aid kits that you might get at the store tend to have some of these things and not a lot of the others. I always am an advocate for making your own kit if you can, and for having some certain information in your phone or on your person in your purse for EMS, which we're going to go over next. So the information that we're going to need to register you with the hospital is your name or the patient's name, date of birth, their address. If emergency contacts are available, these are always very helpful, especially for things like first noticing stroke symptoms or TIA symptoms, mini stroke symptoms. Medical history, if they have any medical problems, any recent surgeries or procedures, medications that they're on, including ones that they've recently stopped because of the withdrawal potential, or some medicines can last for a little bit in the system. Recent dosage changes or any new medicines that maybe were prescribed and haven't been started, or new medicines that may not be on that list that's been in your purse for 6 months, right? Allergies, especially if you've had a serious allergic reaction in the past, it's really important for us to know those things. And I encourage you, whenever you're in doubt, trust your gut and call us if you need us. It's better safe than to be sorry, and you can always refuse services, or you can even cancel us if it turns out that you don't in fact need us. But uh, it's really there. Time is of the essence in a lot of emergencies, and it's one of the most important things you can do is get us en route to you. So with that, I will take any questions that you guys might have.
And while they're thinking about questions, I'll just say I put it in the chat, but the recording of today, as well as the slides, so you'll have all the resources she mentioned and the lists and numbers of things will be emailed out to everyone on Monday. So you will have that. And I am also going to stop the live stream to Facebook so we can, and then we'll just open it up if you want to unmute and ask any questions.